Hello and welcome to the Situation Report for Thunder Bay Regional Health Sciences Center's COVID-19 response. My name is Tracie Smith and I am here with Incident Manager Dr. Stewart Kennedy. And we're here again because COVID testing continues to be a very hot topic in the community. And it's actually causing a lot of stress for people in the community and for folks who work at our assessment center here. What is causing all of the upset, Dr. Kennedy?
Well, first off, Tracie, I was hoping to begin to wind down our incident management team because we've had such good results here in Thunder Bay, which we continue to do. But certainly the province is really heating up, and so is Canada, and so is the world. So I guess I got to put that on the back burners for now.
Would you call this the beginning of phase 2?
Certainly we're creeping toward phase 2. Not in Thunder Bay as yet, but we do expect positive cases to begin to present itself in Thunder Bay. We do expect it to come in the schools. We do expect it to come certainly in the community. We're just hoping to keep it out of the hospitals and keep it out of the long-term care facilities and keep it out of the vulnerable population. So it's still important for the public here to make sure they follow the rules of keeping the distance, the 6 feet, 2 meters, washing their hands, and wear a mask. So
okay.
Getting back to the real question, Tracie, is that we're backlogged. Certainly, we're backlogged with the testing in 2 components, both the assessment center, because there's increased demands, and the criteria that the Ministry of Health and Ontario Health North have been following for the initial phase needs to be reassessed regarding for the testing. I mean, we can't take on testing for asymptomatic patients who just feel they want to be tested. We need to give some of the testing for long-term care, both visitors as well as employees, over to long-term care because our assessment center is getting overwhelmed. It's getting overwhelmed because of the increased demands in the schools. And the schools are following the guidelines by public health, but to follow a guideline of a runny nose and a sore throat needs to be reevaluated because many children, as a primary care physician, I see runny nose and sore throats every single day, and we need to actually put a little bit more science behind our testing, so it relaxes the demand on the assessment center. I know you want to say something, but before I get there, so yesterday or this morning, we've engaged with the Board of Education, Ian McCrae, the Public School Board, and Pino Tassoni from the Catholic School Board, that we really want to begin opening up a second site to deal with the education component of the testing. So we want to deal with teachers, we want to deal with students and parents.
At a separate second assessment center?
As a separate assessment center. We're working now in collaboration with the boards of education to find a site for us. We will train the nurses. We will actually prepare the expertise, and we'll certainly staff it. We just need a site, and so right now I'm hoping that we can confirm opening up that site, if not the end of this week, but hopefully early next week. We're working as a coordinated team to get that moving because we need to take care of the parents, the teachers, and the children in this community to make sure they don't have to stay home for 10 or 15 days. But we also need to encourage the Ministry of Health to look at what are the symptoms that need to be tested and what are the symptoms that really are just the symptoms of a common cold or allergies.
Well, I was going to ask that question because if that ends up being addressed, and people in the community seem to be aware that, for example, in the province of British Columbia, they've reduced the symptoms related to qualifying for a test. So if you just have a runny nose, you don't qualify for a test. So that's what you're talking about when you say reduce the criteria. If
Yes.
that is done, would there need to be testing for school children as much?
Well, sometimes the system doesn't move as quickly as we would like it to move. So we are going to be prepared to open up a second site regardless, because it's the right thing to do. And we need to certainly appreciate what the schools are going through. And they're working in good collaboration with public health, the best they can. But again, it's like when we first got introduced to COVID in March. We were flying by the seat of our pants. We had some guidelines, and right now the boards of education are too. So we're there to help, and we're certainly going to try to make that work. If the demand falls off, we can actually always close down those sites and then go back to our one site. But it's so important that the criteria is re-looked at, because the assessment center is not fair to anybody to wait that long for a test. We have to give priorities to our healthcare workers. We have to give priorities to people who have been exposed in contacts. But as this wave 2 continues to move forward, we have to be more smarter, and we just can't sort of do every test on every individual if they're not meeting certain criteria.
Well, this is a fantastic initiative, because not only does it give students, teachers, parents the access that they're looking for quicker, it takes some of the pressures off of the assessment center here so that other community members can have access sooner as well.
Yeah. And that's just one. So I talked about the front end, getting the testing done, the wait list. The back end to get our turnaround time is also sort of being delayed. I think yesterday in Ontario, 47,000 tests, and what happens there, because of the lab facilities can't keep up, it's delaying turnaround time. And just for an example, here in Thunder Bay, we're allocated 1,500 test kits a month. And that allows us to do 50 tests a day. Yesterday we did 170 tests. So again, there's a backlog in the system, both of the raw materials that we need to process these tests, as well as certainly a delay in the priority testing if we do not have enough. So I'm outlining this not as a criticism, because everybody's doing the best they can, but there's reasons for the backlog, and we need to increase our capacity. We have the ability here in Thunder Bay Regional Hospital to do about 380 tests, but we don't have a day, but we don't have the test kits to do that. We'll run out, so that's why you have to say the priority. Public Health Lab has the ability to do almost 400 tests a day, but again, they can only do up to 200 right now because they don't have the human resources. So we have technology to move things forward, but we need the raw materials to keep up with the turnaround time. So we'll fix it. I guess what I'm asking for the individuals in Thunder Bay and Northwest Ontario to be a little bit more patient, because we're putting the strategies in place that will help with turnaround time. As well, it will assist with decreased wait in the assessment center. So I mean, it's some growing pains. I know I've said that before, but we will get through this. And I'm just asking for the respect of the community and the patients, which I know is very difficult. But we are putting some initiatives in place that hopefully mid next week we will have both a better turnaround time, but also less waits in the assessment center.
Okay, so coming very soon. So right now, people who are asymptomatic or maybe have one symptom like a runny nose sometimes feel that they need to be tested. They can expect longer waits still? How are they triaged?
If we concentrate on the priority individuals that really have significant symptoms, and those significant symptoms are looking at shortness of breath, cough, headache. And those have to be prioritized, and they have to be done right away. Somebody who just wants a test done because they want to see the results, we're not doing them anymore. So from my perspective, don't bother calling if you just want to see your results. If you've had a contact, we certainly want to do that. I mean, if you have symptoms, we certainly want to do that. But we need the ministry to relax some of those guidelines, some of those criteria regarding the common symptoms of a common cold and allergies, and as BC did. And I think they're looking at it. I think they certainly want to sort of move forward. And they also have to look at the need to really test all visitors to long-term care facilities. I mean, is it time to relax that? I need to, consult with the infectious disease experts in Ontario. We certainly don't want to introduce any disease in long-term care facilities, so we want to make sure we take care of our vulnerable population. But certainly, maybe those tests can be done at other sites, not our assessment centers. We've got to be smarter, and I think as we learn more, we will be smarter to make sure we meet the needs of the population.
So that's a little bit of a different message than we're hearing provincially sometimes. I mean, people are encouraged, get a test. Anybody can get a test. If you want a test, go out and get a test. And you're saying now that we're not going to be testing asymptomatic people, with some exceptions, like you say, people going into long-term care facilities, that sort of thing.
We still need to test the people who don't have symptoms, who are going to long-term care facilities, certainly people who are going to vulnerable populations, people who are being transferred up north to a vulnerable population. We still need to do those testing in the asymptomatic people. People who are transferring from hospital to hospital, they still need to be done for the time being. But any people who do not have any symptoms at all, who don't meet those criteria, I strongly encourage them, don't bother calling, because we're obligated by the ministry to actually make sure we offer those tests, but we just don't have the capacity. We need to take care of priorities here at Thunder Regional Hospital in the city to make sure that people who need to test get to test in a timely fashion. So we got to deal with the backlog, the wait times, and that's how we're going to deal with it.
Great. So we know that our assessment center is overwhelmed with phone calls. What sort of volume are we talking about?
When we first took this over from Public Health, I think the volume was less than 200 a day. As of yesterday, we're getting over 1,000 calls a day. In fact, on the weekend, it overloaded our call system, and we had to get Thunder Bay Tel in to come and sort of upgrade the call system. So we are getting, and that's where you're seeing the backlogs. The phone system has broken down because of the amount of calls, the volume of calls. There's a lot of anxiety out there right now. Again, there's a lot of concern out there since the schools have opened. There's a lot of concern because long-term care requires the testing done. So, I mean, the volume of calls have increased, and certainly we think they're going to continue to increase as schools have opened, flu season's coming. So it's going to be a challenge for us. But so certainly it's good to be patient, and I apologize for the long waits. We are going to fix it. It's just not going to be fixed overnight.
People would ask, why can't you just add more people to answer the phones?
That's a great question, but right now, I mean, there has to be a coordinated response. And right now, and the people who answer the phone have to have some clinical skills to prioritize the appointments. So right now, if you phone up and you have some mild symptoms, they have to be determined by the person on the phone who needs a bit of a clinical background to say your appointment won't be for 3 or 4 days. Somebody who has, a headache or shortness of breath, they're going to come in right away and get assessed or be directed to the emergency department. So we need some clinical sort of expertise sort of on those phones, and it takes a while to train these individuals also.
Okay, thank you for clarifying. I just wanted to go back to the assessment center specifically for schools again, because I just have one follow-up question on that. What is your vision for that in terms of turnaround times or wait times? So
right now, our concentration is going to be on the assessment centers and doing the appropriate testing. So we have a team now made up of the Board of Education area, as well as made up of our hospital staff here to look at maybe walk-ins, okay, once we set up the sites. So we'll get the testing done in the appropriate fashion. But again, there is a backlog in the system, and those tests will have to be sent to Public Health Lab Ontario, and so there is a delayed wait time right now. But if we're just doing appropriate testing, the volume of tests should decrease, and that should deal with the backlog. So I'm hoping not doing the asymptomatic patients who do not need it will help deal with some of the backlog.
And speaking of the volumes, now you mentioned that yesterday our hospital performed 170 COVID-19 tests. There are other tests being done in the community as well, right? So EMS is conducting tests as well?
Now that we've been given the authority, we're given the oversight, so Thunder Regional Hospital has given the oversight of the total assessment center. We were informed of that yesterday, so we're working hard to sort of get all the sort of partners together. But there were 600 tests done yesterday in the community with EMS, and EMS have done a remarkable job. I mean, right now they have a large backlog. I think I heard over 1,000. So we're going to help them out with that backlog and try to sort of catch up with the backlog. And certainly, once you catch with the backlog, we can move forward. But yeah, there were 600 tests done in the city yesterday, and certainly the majority were appropriate tests. But it's going to add to any backlog in our testing capacity and our turnaround time, which I think the ministry has got the message, and we have certain initiatives in place to help with the turnaround time.
And EMS is largely focused on testing people in their own homes, children and 12 and under, as well as people who are not ambulatory?
Yes, but all again the calls come through our assessment center, and we actually then distribute the workload to the other sort of assessment centers. And then even we need to have discussions about primary care and see how primary care is going to sort of be involved with this. And again, it's a sort of a moving target that we're trying to sort of slow it down a bit.
Well, fantastic that we have so many community partners at the table, eager to participate and meet the needs of the community. So thank you for all of your work on this, and no time to relax, is it?
Well, we always find some time.
Well, thank you, Dr. Kennedy, and I expect that we will have more developments in the days to come.
We should.
Thank you so much.